started then. Good evening, everyone. I'd like to welcome you to the, we have feedback again? All right, if anyone has their microphone turned on, please turn it off. That will help somewhat. Good evening, everyone. I'd like to call to order the meeting of the Macomb County Community Mental Health Board. And we will begin by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Next, an adoption of the agenda is in order. Motion by Birdie, support by Flynn. Any discussion on the agenda? All in favor signify by saying aye. Aye. Opposed? Next is hearing of the public. This is a time when this board gets to hear from the public. If you could please come up to the microphone here and identify yourself, your name and your address, and you have 5 minutes to speak.
Good evening, everyone. My name is Donna Telly. I live, my complete address, is that what you would like?
You can say your city if you want.
Okay. I live on Remington Drive in Sterling Heights, Michigan. And my husband and I are here this evening to represent the needs of our 34-year-old autistic son regarding his day program. And not only our son, but the many sons and daughters in our county whose programs are being affected by the Medicaid spend down that has come into play. I know that you have all received a copy of the letter that I have sent to many individuals in Macomb County and throughout the state. The only person I neglected to list on that letter was Director Nick Lyon at the Department of Mental Health in Lansing. And it wasn't that he was an afterthought. I just got carried away with my letter writing. So if you would please hear me out, I won't take much of your time. I want to thank you for letting me speak at this meeting on behalf of my son, Brandon. My mind was racing to determine what can be done to help our son regularly attend his day program that he has attended for the past 8 years. Brandon's mental health depends on his structure and the familiarity of his program. The Medicaid spend down, which began for Brandon in April, is affecting his mental health and quality of life. In April, Brandon was not permitted to attend his day program for the first 5 days of the month. In May, he was not permitted to attend his program for the first 10 days of the month. How many days will he need to be banned in the upcoming months? I can't allow this to happen in June and each month to follow. Brandon is at high risk of inflicting injury and pain upon himself when his routine is disrupted for days at a time. His disability of autism causes him the need for structure and routine. Can someone explain to me how Brandon can absorb $660 each month in Medicaid funds so that he can attend his daily program? Do we need to increase his monthly expenses to use up to the $900 a month in Social Security benefits that he receives in order to lower his income status? Isn't $900 a month considered poverty level? I'm trying to learn and come up with ways to get creative, if you will, with spending government dollars in order for Brandon to maintain his mental health. Is that the right thing to do with Medicaid funding that is so desperately needed by many? That seems ludicrous to me. Until his spend down is met, I understand Brandon cannot visit his primary care physician. What happens if he becomes ill, injured due to his self-abuse, or needs an appointment to have meds revisited or prescriptions written? Doesn't Medicaid cover his medical expenses? Am I correct in thinking that Brandon needs to spend $660 out of his pocket of Social Security benefits before Medicaid will pay for his services? I've been trying to speak with as many people as I can to come up with creative ways to meet this monthly spend down. One suggestion was for my husband and I to look into becoming paid guardians for Brandon. Would Medicaid cover this fee, or would this be a monthly bill for Brandon to increase his expenses? Another suggestion was to look into dental and optical insurance for Brandon. Might not be a bad idea. How would this affect his spend down? Would this put Brandon's living expenses in a higher dollar range, enabling his spend down to be reduced or eliminated? If we had a prescription from his primary care physician for his high-calorie diet, which needs to be pureed, would that help to increase his food stamps, which have also been reduced, so I'm told? Do we need to take Brandon to an emergency room on the first day of each month in order for Brandon to meet his spend-down dollars? That would not be fair to Brandon. Is that fair to any hospital system or Medicaid program which is struggling to keep funded? This, to me, would put quite a strain on all systems. Is this what we need to do to spend Medicaid monies? Then hope whomever enters codes into computer systems will do it quickly so Brandon can attend his program on the first day of each month and all of the days to follow and in the future months. Can Brandon's direct care staff from DES attend the Life Skills Day program with him? Medicaid dollars can be used to pay the staff and still provide Brandon with a routine of attending his program. Can he attend Life Skills as a guest with his home staff until his spend down is met? What needs to be done? You can see our minds are working overtime to learn and try to develop creative ways to accommodate our son and his basic needs. I would like to let you know that I was informed yesterday by our supports coordinator that she had forwarded my letter to some individuals at Macomb Oakland Regional Center. And I received a call informing me that Brandon should have been listed as a disabled adult child. DAC status is how they refer to it, with, I believe, the Department of Human Services along with the county. And evidently he was not. As of yesterday, I was told this error was corrected and that Brandon will be all set for future months with his day program. Today I received another call informing me that I personally need to call an individual at CMH by the name of Danielle Gorney, a liaison, to request in writing proof of Brandon's DAC status. I did leave her a voice message today and I'm awaiting a return call from her. I'm assuming this might lead to more information needed from me. Not sure, but you can understand the confusion and the frustration in trying to find details and information on how to help provide services for my son. I'm begging you to revise the structure, so I also know this could take some time. Maybe a waiver can be quickly put in place, allowing my son and others to attend their programs without missing days until the specifics are worked out. Even though I believe our son's situation is cleared up, I'm requesting some investigation into correcting the status of other disabled adult children in Macomb County, those who no longer have parents or guardians that have the ability to advocate for them. Please help us help our son and others. Can we come together as a community to make this happen? Macomb County is known for its great mental health services, as far as I'm concerned. I ask you to please keep this reputation going strong, and I thank you for your time.
Thank you, Mrs. Telly. Is there anyone else that would like to address this board? And just as a reminder, we don't make comments directly to you after you speak, but if you need additional information, we're happy to get that for you.
My name is Charlene Jago, and I live at 27819 Palomino Drive in Warren, Michigan. And I am here on behalf of my son, Joel. Joel was out of high school 5 years before I was able to find a program for him. I'm sorry. That's okay. And we were very happy to find the program of Creative Employment Empowerment Opportunities. And as I understand now, they are facing maybe some cuts. And we're here to ask that you reconsider due to the fact that these young adults need this program. If they didn't have this program, they would be sitting home in front of the television set every day, deteriorating, as he has done in the past. And it's very important. I served on Macomb Intermediate School Board Parent Advisory Committee for 20 years, so I've had a lot of experience with handicapped children. And I have honestly have to say that this has been one of the best programs that I find that Macomb County can have. And they do a lot for these children. They have a lot of free things for them to do. They take them fishing, they take them to the library, they take them to different programs that they have in the community. And they need this. They need the socialization of being out and about in the public. When they're home with their parents can do so much. I myself, I am a single parent, and not by choice, but however, we manage. And it's been difficult for me at times, and he's been home at times with illness and whatnot, and it's hard, as I say. It's very difficult to sit there and try to keep them busy and keep them occupied other than sitting there watching boob tube every day. So I'm truly asking that you would reconsider the cut that you have on the paper here, and that we put back what they have been talking about maybe cutting, so that these young adults in this program, and it's a very good program. In fact, we would like to invite all of you to come visit the program so that they can continue on with their education, their socialization, and the things that they like to do, so that they can get out and about in the community on a daily basis. Thank you.
Thank you.
Good evening. My name is Kim Atwood. I reside at 33676 Bayview Drive, Chesterfield. I am the program supervisor for CEO Mount Clemens and Anchorville. I've been employed there for 13 years. CEO's presence in the community is undeniable. Have you heard or been involved with Focus Hope, Meals on Wheels, Child Help, AMVETS? Did you go to church this last Sunday? If you said yes to any of these, then you've benefited from CEO's community partners and from CEO. These numerous community programs are located in Macomb County, but they change lives. Either you have used these services or someone you know has. This means CEO has affected your life and the lives of your loved ones, not only affecting the lives of the individuals we serve at the community center, but the whole community. We are also partnered with American Cancer Society and the Selfridge Air Show and Open House. For ACS, we have filled bags for cancer survivors, provide support to the events up to and including the day of the event, which was a 24-hour event. I made a copy of our award that we got. We're participating in that. For the Selfridge Air Show, we provided assistance throughout the entire planning process and the day of the event. And today, we still offer and provide support to the soldiers returning home as it's needed. Do you choose a charity that you are passionate about, volunteer your time for? How does this make you feel? Do you feel good about yourself? Do you feel fulfilled? Yes, of course you do, because you're giving back to someone else and giving of yourself. The individuals that attend CEO participate in these partnerships and are given the opportunity to feel the same sense of pride and accomplishment by volunteering. This is only a small part of what CEO offers, but I thought it was an important part. CEO won't be able to continue these valuable partnerships if the 11% budget cut isn't restored, because staff and vans are essential to the day-to-day operations. One more thing I'd like to share with you is it's become so important that everyone is given choices every day. With the 11% budget cut, the individuals that we serve choices could become limited. No one wants to see that happen. At this time, we are offering activity choices daily, trying to help them make choices in what they do. Even the littlest choices we make every day as for what are we having for lunch. We created this menu. We'd like to continue. So you can see they make choices in what they eat even for lunch during the day. We'd like to continue this, so please restore the 11% budget cut so we can continue the work we do and the individuals can continue the community services that they love so much. Let them continue to make their choices.
Thank you.
Hello, my name is Richard Gronowski, and I reside at 46325 Butte Drive in Macomb, Michigan. I'm speaking on behalf of CEO. I have a child who attends CEO. He's approximately 29 years old, but he has the verbal or the communication skills of a 3 or 4-year-old, plus he's autistic. He's attended a CEO program out in Washington Township for the past 2 years, and from what I've seen, he's developing skills that can lead him to some sort of productive future, either packaging or whatever. But he's doing something. We've tried to when I used to go for the meetings at school when he was going at Macomb Intermediate, and the one thing that surprised me was how little they expected of. I'm not knocking the intermediate school district or anything like that, but I'm just saying how little they expected of these children. Whereas I've noticed at CEO, the instructors are constantly working with them, and they're trying to develop some kind of skills, whether it's cleaning, picking up, sweeping, whatever, manual labor. And to me, if you cut a program for CEO, I think you're really shortchanging those kids. They have nothing else. There is, I have a big family and we all get together and we socialize, but I've always noticed that everybody in our family kind of stays clear of Paul. But at school, there's a group of people that he can socialize with, and that they kind of steer him into a direction where he's productive at doing something. So I really hope you can reconsider the budget cuts for CEO. Thank you.
Thank you. Is there anyone else that would like to address this board?
Hello, my name is Sandra Rad. I'm a program supervisor for CEO Clinton Township. I live on Sugar Bush in Chesterfield, Michigan. I've been with CEO for over 21 years, and I'd like to read you a few things that we're doing at CEO. It's very special. The individual served update is we have developed skill development kits to enhance the fine motor skills and coordination of the individuals that we serve. Each kit has a total of 15 different activities which will help in the development of skills which could be used for employment. These are just simple things that we put together. Of course, we have to buy our things from the dollar store, okay? But all these things really work to help the individuals enhance their skills. On May 4th, 2018, we hosted our 25th annual Spring Fling. This event is held to recognize the accomplishments of the individuals served in the areas of skill development, volunteering, educational classes, and employment. There were 500 guests in attendance. The vocational assessment was updated to reflect language supporting the home and community-based services final ruling. Our community center update is that we participated in the Macomb County annual traveling tours with 26 guests in attendance. A new vehicle was purchased for CEO Clinton Township to support the home and community-based services. Our stakeholder update, Creative Empowerment Opportunities delivered 50 flower bouquets for the second annual Support Coordination Appreciation Day at Hope Network, JOAC, and Macomb CMH. The flowers were grown at our Lakeview Urban Flower Farm and were harvested by our microbusiness Flowers by Us. Creative Empowerment Opportunities would like to express our appreciation for your consideration in correcting the 11% rate reduction.
Thank you.
Hi, my name is Ursula Perrin, and I'm here as an advocate speaking on behalf of my brother, Jeffrey Perrin. I do reside, as he does as well, in Mount Clemens, and I was here to speak on his behalf at your last meeting. I ask you to please implore this situation within your hearts and your heads when making the decision to continue to allow the budget to be reinstated for CEO. My brother is autistic, and I'm saying A-W-E-tistic. And I want him to continue to be awesome in his life, and he has been this because of CEO. Like your mission statement, CEO practices the same mission to allow people like my brother and everyone in the community to become social within the community and be an active participant in the community. So I ask that you please give this great consideration so as not to stop the only program that's entitled My Brother, as well as many others, to be non-biased in the community and continue with the benefits of this program. Thank you very much.
Thank you.
Good evening. My name is Laura Cutting. I live at 17904 Crystal River Drive in Macomb. A couple meetings ago, you approved my membership on the Citizens Advisory Committee, and I'm here to thank you for that opportunity. As you may know, reading my bio from a couple meetings ago, I volunteer with NAMI Metro, and NAMI Metro is within the Tri-County area, but I have pretty much taken over the Macomb County support group. There is the family support group, which meets at it used to meet at St. John. Now it's at Henry Ford Hospital on 19. And I was also able to secure some other people, volunteers, to start a peer support group, which meets on the same night. So there's a family support group and a peer support group in our county now. And I wanted to let you know, because I know that you have to talk to your constituents, and you should be able to tell them that NAMI Metro now provides a support group. The other thing that we also provide that used to only happen in Southfield for the last 10 years is a Families in Action educational series. I provided you with a lot of literature there. Feel free to peruse, but also based on my bio, 3 years ago my son tried to take his life. He was diagnosed with severe depression and anxiety, and I had nowhere to turn. I went from my own physicians to not knowing what to do, Googling it, finding NAMI Metro, support group, them telling me Families in Action was the place to go for any new person. Now, with my son in recovery, I find that there's such a need for something like that out there and everywhere. So we have an army of volunteers. There's about 20 of us in Macomb County right now, and our services will be expanding, but I just wanted you to know that we are here. NAMI Metro is stationed out of Southfield. They are in Wayne County, they are in Oakland County, and now we are definitely in Macomb County. So I just wanted you all, and thank you again for letting me go on the Citizens Advisory Council. It is so educational for me to be able to share with my families. Thank you.
Thank you very much. Is there anyone else that would like to address this board?
Good evening. I'm Sean McGregor. I live on St. Clair Avenue. Normally I come up to you guys to talk with a big speech and everything about our points at CEO and everything, but just in reference to restoring the budget cut, I do have to say, as young as I am, I've already had 8 years in the field in mental health services, and much like she said over there about him just rotting there, I have personally firsthand seen that at probably about 3 different nursing homes I've worked at, with nothing from dementia to you name it, anything and everything. And I just have to say, just on behalf of the company and everything, I couldn't be more proud to work at CEO, and just everything that comes with it, and to really see the difference that we're making in people's lives. I was honestly quite overtaken with it when I first started my job, and I've loved it since day one. So thank you for your consideration.
Thank you. Is there anyone else that would like to address this board? Anyone else? And seeing none, we'll move on to the next part of our agenda, which is to approve the minutes of the regular meeting of the board that was held a month ago on April 26, 2018. Motion by Bush, support by O'Connell. Any discussion on the minutes? All in favor signify by saying aye. Any opposed? Motion carries. Next is, I'm going to take these individually. There's the minutes of the Program and Budget Committee meeting held on May 9 of 2018. And on your desk, there is a page that's showing item 4H, correcting the language, and just insert the language that's on this sheet that's on your desk and remove what's in your agenda that you received prior to today for 4H. Is there a motion to approve those minutes as corrected? Motion by Sarah Matero. Support by Nagovan. Any discussion? Do you need time to look at it? I hear some rustling of papers. Okay, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next, is the minutes of the nominating committee held on May 16 of 2018. Do we also, if we accept them on minutes, then we? Okay. All right, so we have, what we'll do first is just approve the minutes of the nominating committee, and then I'll turn it over to the chair of the nominating committee to continue the business of to fulfill the officers. Okay, so the minutes, all in favor of approving the minutes? Signify. Oh, I'm sorry, we need a motion. All right, motion by Flynn, support by Nagovan. All in favor signify by saying aye. Opposed? Minutes carried. Nick, I'll turn it over to you.
Okay, thank you, Madam Chair. As the minutes indicate, the nominating committee did meet. I contacted or left messages, I think, for everybody on the committee, or at least tried to, on the board, rather. There were nominations submitted for the current officers, Chairperson Kathy Vosberg, Vice Chair Joan Flynn, and Secretary Treasurer Linda Bush, all of whom indicated to me with varying degrees of enthusiasm that they were willing to accept the posts. Something they may regret at some point, I don't know. But at least they were willing to accept the post. So those names the nominating committee puts into nomination, and then there are additional nominations that would come from the floor. Do you want me to conduct the election? Okay. So we have those three nominated. Are there any further nominations? Are there any further nominations? Are there any further nominations? Hearing none, nominations will be closed. Do you want to take this one at a time, or can we just do it as a lump? I mean, there are only the three, so I would entertain a motion to reelect the three current officers for the next year.
I would make that motion, and a unanimous ballot should be cast.
Motion by Birdie. I didn't hear who supported it. Doherty, sorry. It's just, the motion has been made and seconded. All in favor indicate by saying aye. Aye. Opposed? Motion's adopted unanimously. Thank you.
Thank you to fellow board members. Next is request to approve, this is item number 6. And these are items A through M were all discussed at our program and budget meeting. Maybe you want to take A through L.
Yeah,
Separate K, all right. And you want to separate M? We'll
Yeah.
separate M as well. So I'll entertain a motion to approve items A, B, C, D, E, F, G, H, I,
J
and L.
J. That includes J.
I'm sorry, yes, and item J, the estoppel certificate. A motion by Nagovan to approve those, supported by O'Connell? All right. Any discussion on those items? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. That brings us back to item 6K, which is approval of residential lease A. We need a motion to approve that. Motion by Doherty, supported by Kraft. Lou wanted to comment.
I do. I will continue to vote no on publishing leases for group homes that do not contain the address of the neighborhood in which the group home is located. Failing to do that is absolutely incorrect, and frankly, it should be an embarrassment. Our position is not to pierce the veil of transparency. Everything we do should be absolutely clear. No one should have to initiate a Freedom of Information Act, pay money to find out the address of a contract that we approve. I will continue to vote no if this board continues to pass contracts on group homes that do not state the address in neighborhoods.
Thank you. And just as a reminder, we, to the other board members, we did get an opinion from the attorney who said that the county corporation council, and he said that it is not a violation of the Open Meetings Act to not publish the address. So in other words, you can publish the address, but if you don't, you are not in violation of any Open Meeting Act. Commissioner Doherty?
Thank you, Madam Chair. And can you just, for the benefit, I mean, I recall this issue, and can you just recap for members of the audience why we don't publish the address?
It's my understanding that out of privacy of the residents at that address, were there any other issues? That was the main reason. You want to?
No, that was the primary issue, and just to ensure the privacy and potential safety of consumers.
Yes, and I concur with that, which is why I made the motion. Thank you.
Mm-hmm. All right, so we have a motion to approve the lease, residential lease A. All in favor signify by saying aye.
Aye.
Opposed? We'll record your no vote. Thank you, everyone. And then next is letter M, the review and discussion of the revised AFIA statement of work and additional proposal information. Motion to approve by Kraft, support by Flynn. Any questions or comments? I have Lou and then Nick.
Actually, when it comes to AFIA, I don't really have a problem with what they do or how they do it. Oddly enough, I feel that the presentation of this item is inappropriate given where we are with our program of dealing with consumers. We have cut the rate of reimbursement to consumers over the last 3.5 or 4 years. Many providers are working at the 2015 rate. This is almost 2019. We have cut services to consumers, unfortunately, because the state of Michigan has cut our funding in the past 1.5 years of approximately $43 million. Instantly, without any advance notice, that's happened over less than the last year. When we have reduced services to consumers and we're reimbursing providers on a rate schedule that's almost 4 years out of whack, and we have a program for computer information that's going to cost $500,000 in the next year plus, in good conscience, I just can't vote to do that. When we ask providers and we ask consumers to make do with what the present situation is, I feel it's our obligation to make do with our present situation until we can provide recovery for consumers that are unfairly being impacted because of what the State Department of Community Health has been doing to Macomb's CMH program. So, it's not the basis of what this computer program might provide. I'm saying that I think we have an obligation to get by on what computer program we have in effect until we can make adjustments to providers and to consumers who have been unfairly impacted. So, sadly, I will have to vote no. I feel that bringing it forward at this time, I hate to use the word inappropriate, but I feel it would be an embarrassment, frankly, to go forward with it as far as I'm personally concerned, until we can do what we need to do with providers and with consumers. So,
Thank you. Lou? I'm sorry, Nick?
Thank you, Madam Chair. The, as I had expressed at the Program and Budget Committee, I have serious reservations about this for many of the reasons that Lou stated as we're cutting others. It's been represented to me, based on my conversations with Director Kinch and with Mr. Losey, that there are several changes that have since been made, that the argument I'm hearing, and I would ask that it be directly addressed by Jim, are what those changes have been since the proposal was before us at Program and Budget, number one. Number two, how is this to be paid for? And I understand there's some grant dollars involved, but that there is still a cost, so what the remainder of the cost would be. And if the indication was that the benefit of the project would be to save costs in other areas, so I would like to hear that reiterated, because if we're saving money for services, that's different than spending money on a program, but also what recourses and how we hold, quite frankly, the administration accountable or get out of this contract or whatever in the event that it doesn't save money. Now, I noticed in some of the materials that Mr. Kinch and Mr. Losey were kind enough to give me that they are suggesting, AFIA are suggesting that we should start to see some savings by the second quarter of the project, that there would be a cost of $178,000, but predicted that there would be some quick win changes that will show initial measurable results, and certainly by the end of the fourth quarter, when the cost goes to $364,000 minus, I think, $75,000 in grant dollars, that would show some tangible savings by policy reports that would increase services rather than reduce services. But I again would like to ask Mr. Losey to address those three issues. What changes have been made since Program and Budget, and the contract, how we're going to pay for this, and how much we expect to save, and if we don't save it, how do we hold ourselves and the administration accountable for the lack of savings that can be plowed back into services, which is what I think all of us are most concerned about.
Yes, I'd be happy to run through the additional information and the changes that we have made with regard to a conversation with the vendor and changes to the statement of work that build in really some safeguards in terms of our ability to see a return on the investment and how quickly we see that and what we can do if we don't. The one document you had in your packet is the one with the blue header. It's the additional documentation for our additional information for the AFIA data proposal. And I'll highlight a few things that are key points to this proposal and how it would work within MCCMH. We have to keep in mind that it's more than a software package. It's really or a software platform or program. It's really a package of services that we'd be receiving from AFIA that, number one, and probably none more significant than another, but them being a data warehouse, which allows us to have more accessible, more readily available data to a wider variety of staff. There would also be a report migration from our current reporting platform, which is fast becoming obsolete, and whenever we reach out to try to run programs, we often find that they're no longer valid because something in the data has changed. There's been a data element that's been reassigned, or some new piece of data has been collected that's not being captured in the data report. So we're constantly going back and having to redo the reports in order to make them continue to be viable for us to use within the administration and program service delivery. This platform and package would allow that to be updated automatically as part of the data warehouse, so we no longer have to go through and do that maintenance to those reports, and that obsolete package would then be retired. The other piece that's equally as important is the subject matter expertise, and that is that we would have folks come in that have worked with other PIHPs and other boards and worked with like providers around the country to help them use data to better define their processes and efficiencies, use it for supervision, use it for changing the way we do business to become more effective, more efficient, and to be able to report outcomes. This is really about our ability to meet our contractual requirements and our ability to keep up with the demands of the marketplace in terms of the ability to report on utilization and costs and efficiencies and outcomes. And those are critically important things for us moving forward as the needs of the department and needs of potential payers become more and more complex. We have to have the ability to be able to report in ways they want to see information. Otherwise, we continue to fall behind and spend much more time trying to generate those reports than we need to be. The other important piece that I wanted to highlight, I think that is responsive to Nick's questions, and I know other board members' questions as well, is how do we pay for it? The improvements to the processes and the efficiencies that we'll receive, as Afia had indicated in their revised proposal, we built in touch points that on a quarterly basis we'll be able to look at, okay, where are we at in terms of our ability to see an impact to their activity. If we're not seeing that, we have the option to get out of the contract with a 30-day termination notice, as opposed to it just renewing each year as we had previously discussed last time. The results that we should be able to see, as Nick highlighted, in the first quarter, we should be able to see some initial quick win items that are being targeted for process changes that will, by the second quarter, result in some changes that will allow us to see real savings against the expenditures. And over time, over the life of the first year of the contract, we should be able to continually see building efficiencies and building changes to processes that will allow us to experience enough savings, in my estimation, to pay for the contract as well as have additional monies left over to return to services. The other piece that is important in terms of the return on investment is that not all the return on investment is going to be monetary. Our ability to report back to the department in a timely way and our ability to reduce and be in line with the key performance indicators is going to be critically important going forward. One of the items that we are continually having a problem with is recidivism from inpatient acute care settings. We have a standard of, I believe it's 15% within 30 days after admission, or I'm sorry, after discharge from an inpatient hospitalization. We continually run 16, 17, 18 and more percent of recidivism. So we are outside of that KPI on a regular basis. This will have a direct impact on that. We will see process changes that will allow us to reduce that recidivism rate. We have thrown a lot of resources at recidivism. We tried a number of different things, from hospital liaisons, where we're going out and talking to consumers about the importance of connecting with aftercare, from directly engaging people, transporting them from the hospital at the point of discharge over to one of our clinic sites in order to try to get them engaged. And we've not been able to make a significant impact on that recidivism number. We need some expertise in order to tackle that. Every effort that we've thrown at it right now, has not resulted in the outcome that we want to see. we need more expertise to look at that and help us design some processes that will result in lowering that recidivism rate. So not all of the return on investment will be monetary. The other major piece of it is that as we are able to make better decisions regarding who goes into an inpatient setting, every inpatient setting, every inpatient admission we're able to divert is a better outcome for a consumer. The most traumatic service that a consumer might receive is to have to go inpatient. And if we have a better alternative that we can identify for that consumer and put them into a diversion program, whether it's crisis residential or crisis stabilization, that is a much better outcome for a consumer. And we believe that this proposal will allow us to put processes in place to make better decisions around the use of those diversions. How are we protected if we don't see the return on investment? Again, touch points that are now built into the contract. If you look on page 3 of the data report or the additional information, you'll see after the first quarter we have a touch point and a cost to the contract at that point in time, how much it will cost, how much we will have invested at that point in time, and the outcome, what's the deliverable we should be able to see at that point in time. And we will evaluate that contract and that deliverable at that point in time and make adjustments as necessary in order to make sure we're getting that return on investment that we expect to see. For quarter 2, the investment, and then we should also start to see some measurable results. We will have processes in place that will result in some savings that we'll be able to see that the contract's going in the right direction, and then by the third quarter, be able to see additional savings related to those process changes. By the fourth quarter, we expect to be able to see clear quarter-over-quarter improvements to the processes and then resultant dollar savings. In years 1 and 2, we can devote $75,000 each year from grant dollars to this project. So the first year cost would total $289,000, and then the second year cost, that whole data warehouse piece will be built. So the second year cost would be less than half of the $120,000 or $130,000, I think, which was projected. So we'd be in the $85,000, $95,000 range. So there'd be considerable savings there. The other piece I want to highlight, can you pass that around then? Within the statement of work that was included in the packet, you'll see the various touch points that had been designated in terms of what we would expect to see with regard to the deliverables and the savings. And then also a request by the board was that we see a date certain to the contract end. And that's what the revision that has come around represents. We were able to get in touch with the FIA, have them identify June 1 as a start date with a date certain of May 31 as an end date, and that will require then the contract to come back to the board for any reapproval and renewal of the contract. So we had removed the automatic renewal provision to it. So that provides a date certain for the contract end and review by the board prior to it being renewed. So those are highlights of the changes that we have made to the contract and the additional information that board members had requested since last meeting.
Thank you. I see O'Connell, Doherty, and Bush. Chris?
Thank you. I would just like to mention that the investment in infrastructure and technology, albeit not seeming to be a good alternative for investing this money in direct patient care, is a necessary cost of doing business, especially in healthcare. In the health system I work in, we invest millions of dollars in an electronic health record. And what it gained us was efficiencies in generating reports, mining data, sending information back and forth. So as was mentioned, you may not see that the dollar amounts come out right away, but over time, these efficiencies are realized in the day-to-day business. IT costs can be very expensive if you find yourself in a situation where you have an obsolete system. And then not only are you struggling to meet the needs of getting the data reports that you need, but it's not a quick changeover. So you find that if you wait on investing in IT and look for a cheaper alternative, in the long run, sometimes ends up costing you even more money. So I would just caution to keep those things in mind and understand that from what I've heard, we're going to get better data mining, better storage of our data, transfer of these reports, which are required of us, more efficiently, in a system that is more modern than what we have now. And we have content experts that can help us navigate this so that we make sure that we're doing it correctly. So I would just ask everyone to consider that before you vote, that we don't want to find ourselves a year, 2 years down the road looking at a bigger price tag with a new group that's got to learn our current system and figure out a way to transition to a future state, and do it in a way that fulfills our obligations in a timely manner.
Thank you. Susan?
Thank you, Madam Chair. So I apologize, I was not at Program and Budget, so I wasn't able to ask a few questions about this contract. So I am in favor of it for the reasons that Dr. O'Connell expressed, that we are a very data-driven society, and if we expect to be able to defend the cuts that are being made by the state, we have to have the data to support it. So my questions are kind of in line with that. First of all, I want to say I like that it's a Michigan-based company. They're located in Ann Arbor. So they're, them having to come on site hopefully will not be cost prohibitive versus if they had to fly in or something like that. So I like that because it'll hopefully contain some expenses, maybe doing some things via conference call or whatever. But I'm concerned because we're projecting a lot of these expectations under the system, and it appears that the company is in agreement with these projections, but there doesn't seem to be any service level agreements, which is kind of customary in some of these contracts, where you're saying if you're not going to customize a report in a certain period of time, then, or if the system isn't accessible during normal business hours, whatever your criteria is, you usually bake into contracts to say you're going to meet these deliverables, and if you miss these deliverables, these are the financial penalties. So that's one thing that I would like to see in a whole as we engage in any contracts, that we set these service level agreements and that we have financial penalties to the companies tied to them that they have to issue funds back. So that's one thing. I also would like to know, is this a we call it off the shelf product? Is this a product that other institutions use, other mental health organizations or healthcare organizations use, that it's kind of a standard set of data, or is this something they're building custom for us?
This is something that's being built custom for us. Their line of business is to do this kind of work. However, each of the implementations is so unique that everything ends up being a custom implementation, because even though maybe I think there's 8 boards that have PCE or PCE data, an EHR product, they're all so very different. They're different implementations of the same framework. They end up being a custom installation because they really can't take a standard package and just plug it in, which I think works to our advantage, that we end up with a truly custom product that meets our individual needs.
So there's pros and cons to that, right? I mean, we are an agency that is replicated throughout the state, and the reporting and the subject to budgets and things like that is consistent throughout all these organizations, yet we're building something custom. Was this product compared to something that was off the shelf in terms of pricing and viability?
We talked to a number of companies as we were looking at the development of a data warehouse. We talked to a number of them that were not able to meet the needs
Okay.
of developing a data warehouse.
Okay.
Again, I think because of the implementations of the various products, I agree with you that everybody's required to provide the same data set to the state. So you'd think there'd be some simplicity that could be garnered there, but because of everybody's implementation being a little bit and sometimes a lot different than others, that I don't think that would be viable for somebody to have an off-the-shelf package and be able to take it around to all the PIHPs and make it work. There is some interest in the state developing a separate data warehouse, but I think that's probably years away from happening.
Right, yeah, we need it sooner than that.
Yep.
So, since this is customizable for us, my next question is there anything built into this that permits us to track, so I wanna choose my words carefully so that I don't upset anyone, but, we know that we provide services as medically necessary, but we also know that, as we've seen from, people, consumers and their families, that the definition of that has some variability and differing of opinions in it. And because we've seen some services that were deemed necessary in the past and now are not deemed necessary and they've been cut because of different reasons, my question is there a way to track services that would improve the lives of consumers significantly, but maybe are not at this moment deemed medically necessary? Is this system going to help us track that so that we can? I feel like we're not measuring that gap, right? I mean, we know that we have to provide services to medical necessity, but then there are services that, while maybe not medically necessary, significantly improve the lives of the consumers. And I want a way to measure that so that we know what services are being lost as a result of the changes in these definitions of medical necessity.
Yeah, I don't believe that this particular program is going to allow us to do any type of automated assessment of that. I think what it will allow us to do is to look at the decisions that are being made locally and have our supervisors be more aware of who's making decisions and learn from them why they are making one decision over another decision. One of the pieces that we have in place right now in terms of the data is a hospital dashboard. And one of the things that we can look at as part of the hospital dashboard is our overall inpatient admission rate. Right. And then we can drill down and say, okay, for more detailed data, who's making that decision? Who has evaluated that request for admission? And what is their individual percentage for admission? So we can then look at those percentages and say, okay, if our admission rate is 62%, but then we've got a staff person that maybe is admitting at 82%, that bears some supervision. Why are you making decisions that are 20% higher than our average decision? So I think that goes a little bit to that discussion in terms of why are one set of services being medically necessary or deemed medically necessary by one staff person versus somebody else. You're absolutely right that the definition of medically necessary is troublesome to me. It's very vague. It's easy to look at it in a number of different ways and make a decision in a number of different ways based on case presentation, what the service is, and who's reviewing it.
Right.
So it is a difficult concept to, I think, evaluate all the time, but I think this puts tools in the hands of the supervisors where they can look at who's doing what at what rates and then do some more effective supervision in terms of why wasn't this case, in your estimation, appropriate for diversion versus going inpatient, those type of decision making.
Okay. Are you anticipating that the projected hours in this packet, because I see a lot of things in here saying, 5 to 10 highly complex reports. I'm seeing some words in here that make me a little nervous, because how do you define highly complex reports, right? So and then it's got billable hours above that. Do we have any idea of what a change control budget is going to look like for this product?
I probably would be more comfortable having some better definitions of highly complex, and I think we could probably get that. AFIA has been very collegial to work with, and up to this point has provided us a lot of services for free. We have a contract with them. I think it's 10 hours a month to develop data reports, and they routinely exceed that contribution, and we're able to have them work on programs like when we were looking to identify the costs of the DAB to TANF to Healthy Michigan migration. That wasn't something that we could do in-house, and they worked with us to develop the reporting models for that in order to have us be able to put a number to that on the kind of time frame that the department or the board association was looking for. And that was a complicated report and something that they were able to provide to us without any problem.
Okay. And then this is my last question. How much history are you pulling into this system? Is it going to be just from this point forward, or are you going to migrate old data into it?
Well, it's going to be a separate product or separate warehouse. There actually is a kind of an interim step. The information will go from the focus system into a kind of a holding tank where that information will be verified within that separate entity, so that it will look back at the record and say, okay, if we've got a conflict between gender, it can go in and say, all right, based on the information that's in the record, we believe that this consumer is male or female. So it will help us verify, and that's a very simple example, but it will help us verify the information that's currently in the system. Then that verified system will stand alone separately in the data warehouse. So any reporting that will be doing will be out of the verified data warehouse. So it will dramatically increase our accuracy in terms of the information that's coming out of the system.
Okay, so that's just point-to-point data, but how much historical,
Anything that's available in Focus right now will be included, which is back to 2006. Yeah.
Yes. Okay, thank you.
Linda?
Thanks, Kathy. I appreciate the efforts that the staff have made to give us additional information that we needed to vote tonight. I also talked to staff and came away with the idea, which kind of maybe I already knew, but with the idea that to not do this, we put dollars for consumers more at risk than doing it. That in this environment, things have to be reported, they have to be reported correctly, or there's incredible penalty, and we're not able to use the data to determine our services and how to operate as a business. So I'm going to be in support of this.
Seeing no other speakers except Nick, who just raised his hand. I'm looking here, I don't see it. And Lou, Nick? Okay. Nick?
Yeah, Jim, again, first off, I appreciate the 30-day out piece, and I appreciate the fact that we're not rolling over automatically, that will come back to the board for review to see if we are making any savings. I don't agree with you that recidivism isn't a cost savings as well as a benefit to the consumer, obviously. because I think that frees up money to help somebody else. So I think the bigger problem, or the bigger concern I have, is quantifying the savings. Are you projecting that this will essentially pay for itself? And are you intending to provide us with the results of the quarterly reports?
I think it's difficult to say absolutely without any uncertainty that it will pay for itself, but I have every belief that it will pay for itself and result in additional savings. We can certainly create a touch point report that comes back to the board after 90 days, second quarter, third quarter.
Well, you're going to receive quarterly reports, correct?
Yes, yeah.
So those will be shared with the board, I assume?
We can certainly do that, yes.
Okay. And again, I mean, I think our biggest, the biggest concern I've had, as Lou's expressed, there's a difference between spending money and investing money. And Dr. O'Connell, I think, I'm mispronouncing everybody's names today, but when you have a name like Shematero, you're allowed. Dr. O'Connell correctly pointed out, this is some of the things we're going to have to do sooner or later to improve our data management system. But again, unless we can demonstrate, if we're going to get the $75,000 grant that reduces the cost. If there are going to be the right people hospitalized and not the wrong people hospitalized, and that we reduce the amount of hospitalization through diversions, that we should see relatively quickly, and that will help pay for the cost as well as be a benefit to consumers. My biggest concern, though, is, and I'm not opposed to sort of experimenting on things to try to save dollars by making the system more efficient, but we've done that in a couple of other areas that have failed to meet the projections. That's why I think it's most important that we get back the data as quickly as possible in terms of whether or not this is meeting our expectations and reducing the cost of the overall project to something reasonable, and therefore by making us more efficient. That is a service to consumers. So I'm grateful for those two changes. I'm grateful we were able to help on the rates with CEO tonight. Some of them may be lost because we did it in a big batch of things instead of individually. But I am glad that we're not going to automatically renew this contract, that we're going to readjust it. And I think it's important that we review whether or not, I really like Susan's idea of there being a penalty if the benchmarks aren't made, but that not being in there, the right to cancel on the 30 days notice is, if we get the quarterly reports, gives us the opportunity to say, whoops, this isn't working, end it now before we get in too deeply. So I think that's an important point as well. But I am concerned about, in these quarterly reports, that we quantify the savings and compare them to the cost, because any cost at this point is a concern, and I think you can quantify recidivism savings and some other savings as well.
Yeah, I agree. I think that there certainly there's a number, a percentage attached to the number of people that recidivate back into the inpatient hospital. But I think your point's a good one, that we need to look at what the rate of inpatient admission is, but we also have to look at the rate of diversion and where people are going if they are deemed to be meeting criteria for inpatient hospitalization, but we have diversions that are appropriate and are less costly and better outcomes for consumers. I think we have to make sure that we're tracking that as well and make sure that number, that inpatient admission rate may come down, but we also need to see that diversion rate go up in order to make sure that we are putting people into the appropriate service level.
Is that it? Lou?
Well, as I said earlier, it's not a question of a computer program. I certainly know and realize that we live in a computerized atmosphere. There's no question about that. What I said earlier was that I was concerned with the timing of the presentation of this contract. Let me be a little more specific. In the past, we have had presentations that if we initiated a certain program, there would be a cost saving and it would be worth the initiation of the program. That has not always been true, or that has not always worked out as hoped for and intended. As a matter of fact, without being too specific, programs of that nature continue to provide a negative impact on our funding to maintain them when they're not producing the savings that we had anticipated and hoped for. I'm concerned that this could be another program of that nature. Let me get specific. If you look at the budget that was presented in the information that came and was again reiterated tonight, the first year, regardless of what was presented, we will have to spend $364,800 and some odd dollars to get rolling before any impact can even be projected by the first quarter. That is the commitment that will have to occur according to what is presented, and then the follow-up in the second year takes that $364,000 to that additional $123,000 to $500,000. But let me get a little bit more specific. If you look at what was presented under hosted analytics, there's a budget of $20,000 for that. If you go to page 83 on the data that was sent out, and you look under fees and assumptions under hosted analytics that will be billed on a yearly basis, let me read them to you if you haven't noticed them. $200 an hour for the executive, $225 an hour for the VP of Finance, $175 an hour for the AFIA directors, $150 an hour for the project manager, $150 for the data analyst, $140 an hour for the senior consultant, $135 an hour for the AFIA consultant. Then it says any travel will be reimbursed at 50% of the above rates. So thank goodness they're in Ann Arbor, because it seems to be a portal-to-portal contract, just like a plumber. You call a plumber, and when he leaves his house, the clock is ticking. This says travel is reimbursed at 50% of the above hourly rates, plus mileage, plus expenses. So when I look at this, I'm going to make a comment which I made earlier, where I'm going to say, I don't think this budget's going to cut the mustard in the first year or even the second. I don't think it's going to turn the corner as presented based on the projections of quarterly expectations for returns. So I'm going to say again, I understand the value of computerized information. And I understand that administration is telling me that our system is not as good as this system would be. And I'm saying, I regret that very much. I really do. But if we're going to ask providers and we're going to ask consumers to make do, I think initially in this critical time, when it's obvious to me that this budget isn't going to cut the mustard, and that's the reality of the situation, based on anticipated projections that might be forthcoming, that we might be able to get out of the contract But if you look at what is proposed, you're already committed for 364,000 before you can get out of anything, because you got to set up the data warehouse, you have to report the migration, you have the management of overall the hosted analytics. It just rolls right down the road. So if you exercise a 30-day out, at what point is it effective against a 364,000 commitment in the first year? And I, subject to being told differently as you progress along, if you pass this, when do you add money to it when I'm saying that the projects that I see budgeted here aren't going to be sufficient? And I anticipate that the 364, if passed, you'll be requested for additional funds for whatever reason without support that makes it self-sufficient or worth the investment. The timing bothers me.
Thank you.
I frankly can't see doing it at this time in this manner with these numbers.
Thank you. Seeing no other speakers, we have a motion and support. All in favor of adopting or approving this contract signify by saying aye. Aye. Opposed?
No?
We have one no.
2 noes.
2 noes?
Yep.
Thank you. And that concludes item number 6. Is there anyone left here from CEO company? Okay, just I didn't realize that it was going to take this long for this part of the discussion, but I just wanted you to realize we did pass the increase. Okay, very good. All right, thank you. And now we'll move on to item number 7, which is to receive and file the 2017 Macomb County Community Mental Health Board Report. Oh, that's the board report, the policy development thing. All right. Thank you. Motion to approve the revisions, support by Kraft. Any discussion on the revisions? Or any questions on the revisions, I guess would be more at. Any major changes that, most of them are just technical revisions as we're told of changes we have to make, we
Correct.
insert
They're
those.
primarily technical revision, plus each one of these would have come before the board either individually or in a package prior to this. This is just
So
a
it's just summary
report
of the
what has
ones
been
we've
done.
approved already, or are aware of. All right, we have a motion? All right, we need a correct. All right, all in favor of receiving and filing? Opposed? Motion carries. Next, resolutions, which we do not have any on our agenda tonight. Item number 9 is to approve the payment of the bills. Motion by Birdie, support by Flynn. Any questions or discussion on the bills? All in favor signify by saying aye. Opposed? Motion carries. The bills are to be paid. And next is the management report.
Thank you. For your calendars, we have a Personnel Committee meeting on Monday, June 4th at 7:30 a.m. at the Community Care Center on 15 Mile Road. We will be doing service award presentations at that time, and I believe we have in the area of 160 awards to be handed out. June 4, 7:30 a.m. Yes, Monday. And I believe staff is invited that are eligible to receive an award. Those staff will be invited, and I think we should have pretty decent participation.
And just for clarity, that's at 15 Mile.
That's correct. It's at 15 Mile, yes.
So I
Yes.
just want to make sure everyone's aware that's at 15 Mile. Nah, don't come to Homer. That would be a mistake I would make.
Program and budget is Wednesday, June 13th at 6 p.m. here. We have a Metro Region dinner meeting scheduled for Tuesday, June 19th at 6 p.m. with the location to be determined. Are we host for that? Do you know if we're host for the Metro Region dinner, Barb? Do you know, are we host for Metro Region dinner? Okay, okay. Location to be determined, and that will be sent out as soon as we've identified that. And then full board on Wednesday, June 27th, 6 p.m. here. There will also be a community collaboration public forum entitled Mental Health Peace of Mind on Saturday, June 2nd at the MISD from 12 to 3:30 p.m. And that is in conjunction with NAMI. And Nick, I think you've been involved in that as well. I know John and I are both being on the agenda to speak, as well as I'm sure Fred Cummings will speak, as well as some other folks involved with NAMI. And that is June 2nd from 12 to 3:30. RSVP is preferred but not required. And then finally, I did want to highlight that John sent out late in the day a copy of a letter that went to Tom Leonard at the House of Representatives from the Macomb delegation in support of restoration of the $7.5 million as a smoothing effect for the Medicaid rebasing, signed by all of our county delegation. That went out, I believe, today, correct? So it's a very nicely written letter. If you haven't had a chance to read it, I'd encourage you to do so. It provides strong support for the $7.5 million. So we'll see what happens. And that's it.
That's it. All right. Thank you. Are there any other agenda items from the members here? Linda?
I want to thank Lori for coming tonight. She, as she indicated, she's new on the Citizens Advisory Council, and a great addition. For a while, Macomb didn't really have a relationship with a local NAMI. There was, people were going sometimes to Beaumont Hospital and so forth, but now, I'm not sure exactly how it happened, but Lori's a great leader in that it's actually at Henry Ford Hospital. They have 2 meetings, as she indicated, and the information is in the package that she gave you. But they have, in separate rooms, a meeting for the family, and then in the other room, a meeting for peer support, so people can drive together. So that's a great idea, great arrangement. And they also have, in your packet, I brought it to point out, so I didn't know you were going to be here. I got to find it. The Families in Action, is that what it's called? It's a how many weeks? 10-week class that families can go to and get support and education and meet other, here it is. Families in Action, and the agenda is community resources, signs and symptoms, medications, stress management, communication skills, dual diagnosis, dealing with difficult symptoms, and support recovery. So it's a great place for families to get more information and learn more about what they're dealing with. So I just want to thank you for your service and for joining the CAC. And again, I've said this before, Lori Valueway has done a great job expanding the membership. It was kind of waning for a while, and now there's a great group of people, and like Lori said, you get a lot of information. John comes every month and gives a really in-depth kind of, I learned a lot from going to the CAC. He gives a lot of good information about things that are going on, and he has the whiteboard so he can really point things out too. So thanks.
Thank you. I don't see any other speakers on the list.
You gotta turn this way once in a while.
Well, you gotta sign in, man. All right. Go ahead. Go ahead.
I just want to point out that June 13th and the regional dinner, I will not be able to attend because my job's taking me out of town.
Anyone else?
For the family that spoke to us about, I worked for social services and I've tried not to deal with Medicaid, but I'm not understanding, from what I used to know about spend down, it was for people who had excess income, kind of excess according to the standards of Medicaid. I'm not understanding a family having a social security check of $900 and a spend down of $660. And add that to what the presentation John gave us about spend down and ATP and all of that. I wonder if there's a need for the board to have a little more information or a little more work on the spend down. And we've been getting letters from our providers and so forth. So I think maybe we need an educational kind of session around that.
Thank you for bringing that up. It would be very helpful. And I think, did you hear the speaker also say that they received notice they were misclassified? So.
Okay. But not on their spend down, I don't think, but maybe.
Well, that was
Right.
part of it, so.
Right. Good.
Anyway, it's being dealt with. I talked to them beforehand. All right, anyone else? Seeing none, we will move on to the next item, which is hearing of the public again. Would anyone from the public like to address this body?
Good evening. My name is Kathleen Kuntz-Pilak. I reside in Algonac, Michigan, and I am the Executive Director of Creative Empowerment Opportunities. And I want to commend you as board members and as public servants and as advocates for people with intellectual disabilities and people in recovery and mental health. What you've done tonight will restore the monies that were incorrectly calculated for CEO. The 11% budget cut has been devastating over the last 12 months. It was over a $200,000 loss per agency. But the monies that you've restored will allow us to continue to provide the quality services and to carry out the mission of this board. Thank you on behalf of everyone we serve. Thank you.
Anyone else?
My name is Bill Wayland. I am from Chesterfield Township, and I wasn't going to say anything because this is my first time to come and listen to your meetings. But when I heard the comment about spend down, my family is suffering mightily over this, and if we don't get a resolution by June 1st, they're cutting all his Medicaid. My son's 25 years old. Well, he's 26 now, so he's aging out of the school system. And we're trying to get a independent living going for him, which he's been very receptive to. Unfortunately, I didn't prepare a letter or anything to really state our concerns. I'll probably come to your next meeting. But this whole spend down thing is if the board here is confused about it, the workers that work for community mental health don't understand it either. I got into a situation where I retired before my son was 18 years old, and so he's RSDI, whatever that is, retirement, Social Security. So he gets 50% of mine, and the spend down is greater than half, which leaves him, less than if he was just on SSI. And for the last 5 years, we've been trying to understand it. When I retired in 2008, it was not an issue. And I didn't know anything else, but that, we got this. He wasn't ready to live independently yet. So we didn't follow up on it until later, about 3 years ago, we started looking for an apartment for him, and we found one finally after a 2-year search. Signed a lease, outfitted the apartment with furniture, and we've been getting CLS plus. He has HHS needs for taking medications and things like that he can't manage himself because of fine motor skill issues. He may or may not be able to work because of those issues, or he could work with supported employment. So we've got all those issues, and it's been hard until the last 6 months or a year to talk to CMH and DHS or HHS, all these acronyms. Because of HIPAA, they couldn't talk to each other, and so we can't have a sit-down meeting with all of them because there's 5 or 6 different agencies, and it's just, I don't think you guys really understand the level of stress and confusion and lack of information. We learned something new that was different than yesterday almost every single day, and it's just unbelievable. And I know that it's a situation that hits a very small percentage of the consumers, but my son is still alive. He's out there, and he needs care. Now, if I was 50 years old, fine, but I was 50 years old when he was born, so he's 26, and I'll be 76 in a few months. I'd like to know when I pass that somebody's going to be watching and taking care of him in dignity, and that so far, in the last 3 or 4 years that we've been trying to do this, I don't see an answer. And the farther we get into it, now with these budget cuts, and he was fine for a while, but now CLS doesn't count against the spend down. The monthly worker that comes to our home or his home and checks on him every month, that money doesn't go towards it. You got to do something. It's only less than 5%, I think, of the consumers that I've been told that are under these kind of restrictions. I've tried to get an explanation of it, and somebody just sent me an email with an entire packet of how to do all of this stuff. You know, I don't have time to go through a packet that thick from community mental health offices in a sarcastic manner in an email and learn how to do that guy's job, okay? My taxes pay you to do that job. And I think I'll stop there before I get madder, okay? Thank you. Please consider explaining to the consumers of this state and this county what this is all about. As of June 1st, he's going to lose his Medicaid, and I don't know what we're going to do about it. The other thing is, if I take what it's going to take to cover the spend down and his Social Security so that we can at least get Medicaid, the problem is that in-kind income? Does he now have over $2,000 a month and can't get Medicaid anyway? And I can't buy separate insurance because in somebody's wisdom, they've taken away the pre-existing condition thing. So my wife and I had two successful careers. My wife's a PhD in medical research. She was on Governor Engler's Disability Network up in Lansing. She went to on a board meeting they had up there for 3 years. I've been part of the community school systems here in Macomb. We've done everything right in our book, and then as soon as my son's 3 years away from becoming fully independent, which was the promise for the last 25 years, all of a sudden, you know, they said, well, if you get more than so many hours of CLS in a month, then he's got to go in a group home. Well, enough said.
Thank you.
Sir, I can appreciate the struggles that you're dealing with regarding the spend down in your son. And Linda, I would appreciate it if there is some way to form some sort of a committee or a meeting to help not only inform us parents as to what this spend down is and make sense of it all, but also the agencies and the school programs and the day programs that work with our kids. Nobody seems to understand just what this all entails, but we are all feeling the difficulties that the spend down is causing. So if you are up to forming a committee, if anybody here is up to forming a committee, I am more than happy to join that to try to make sense of it. Thank you.
Is there anyone else that would like to address this board? Seeing none, that brings us to item 13, which is adjournment, and this meeting is adjourned.